So yeah, back to your point, I think the AOA has said that there's over 267 diseases that can be detected through the eyes. And with that in mind, we're not the only ones who are privy to that information. There are others outside of the sector who are looking to disrupt this eye care and healthcare space in general, eye care specifically, because there's so many different things that you can do with it.
There are very few ODs who spend a chunk of their career as industry vendor leaders, and Dr. Millie Knight is one of them. She's seen it all, from owning a private practice in the Chicago area to being a leading OD at industry giants like J&J Vision Care and EssilorLuxottica. Now she's an industry consultant, and her perspective on how ODs can take control of their own industry is compelling. And this conversation gets a lot of thoughts out of her incredible mind. I hope you enjoy it. This is the Think Again podcast. Hello, Dr. Knight. How are you?
Hello, Dr. Jens. How are you?
I'm doing really well. Thanks for coming on. We really appreciate you being here.
Of course. Thanks for the invitation.
I want to start by asking you a question about a really unique perspective you have as somebody who's been an OD leader in the industry. While many practicing ODs don't really understand how their industry vendor partners work behind the scenes to support them, you've seen it. I mean, the doctors see financial programs and incentives, but give us a little bit of a sense now that you're out of that industry vendor world, what those companies do to support the ODs that the ODs don't quite see.
So I think, thank you for that question, because it's actually pretty broad. And there are things that are overt, and then there are some things that are behind the scenes. One of the things that you probably know I've done quite a bit of is advocacy work on behalf of the profession. So when it comes to driving initiatives around things like myopia and talking to governmental representatives, both on the state level and on the federal level, to get them to get behind more research in those areas, to get more dollars into those areas so that consumers can become more aware. Some of the other programs like the Global Myopia Awareness Coalition, where I was able to work on behalf of EssilorLuxottica at the time, with about 15 other companies who all pooled their resources, and not just their dollar resources, but the influence that they had, again, with other legislators, as well as their manpower, either their marketing departments or their public relations and communications departments, to all work together on behalf of the profession to move us forward. So,
I mean, you even spoke at Capitol Hill one time.
yeah, so that was also, really interesting opportunity. I had just gotten out of practice, and had literally been with the company probably 2 months when we were not subpoenaed, but we were strongly encouraged to come to the Hill and speak with the Senate subcommittee during a hearing on a pricing policy that I really believed really helped the private practitioners to be able to better support their patients and get competitive pricing on the products. And so I did have an opportunity to speak along with the American Optometric Association, then president, and then a consumer group and others who were actually in opposition to the bill. But I think I did my best using my own perspective as a clinician and someone who really wanted to make it as convenient as possible for my patients. Number one, to get the best pricing they could, not to have to go traveling around, searching around. If I could provide a convenient way for them to get the product in my office and ship it directly to their home. And so I was able to speak from the heart on that. And afterwards, the senator who was leading that subcommittee came to me afterwards and said, that it was a very compelling argument. So that made me feel really good that, it's that type of thing that I can really speak from the heart on behalf of clinicians, knowing that we're doing the right thing and continuing to move forward that credo that we take, that oath that we take when we say we are going to do our best by our patients as optometrists.
Well, we're all appreciative of the things you've done behind the scenes. You explained them a little bit here. Let's talk a little bit about now you being out of industry, being an advisor in the market. You are you are seeing things, and I think you have some interesting points of view that the audience would find compelling. You and I've talked a little bit about how you feel like our organizations, whether they're associations or others, should be thinking about driving the future of the industry. I know you went recently to a summit where there was kind of some innovation going on. Tell me a little bit about that and how it made you feel coming out of it. What can we learn from it as you were there witnessing it?
So I've had an opportunity to experience this innovation summit that's put on by Bart Foster, Executive Outside, Business Outside, and Sanitas organization. And it is one of others that I've also had an opportunity to attend. But the thing that's really unique about this is that we get a chance to see firsthand some of the innovation that's going to be coming into the space and some that's already there that we may not be aware of. And they're looking to scale it and to get more traction. And many of these innovations and innovators come from other countries, and they're looking for primary care providers. Notice I didn't say optometrist and I didn't say ophthalmologist. They're looking for primary care providers to provide these eye care opportunities. And many of them are utilized in the eye, if you will, as a biomarker in order to look for systemic conditions and to be able to address and treat them sooner. And so here's a huge opportunity for us. And I think we have gotten very comfortable over the years of looking at the eye care space as our own private domain. But if we're not vigilant, it will not be, because with the advent of AI technology and a lot of creative minds that are looking for ways to get the consumers what they need and what they want from their healthcare experience, we could be marginalized in this case if we're not proactive in helping to shape what that looks like.
So we fought for so long to be primary eye care providers. And I think we've tried to convey, certainly through our national associations and such,
Mhm.
that we have the ability to determine matters of systemic health through ocular examination. But what I think I hear you saying is that we need to be a little bit more willing to look at some of these disruptions that are being brought by some cases non-ODs, non-US folks that are going to change the way eye and vision care may be delivered. Do you think that's actually on the horizon?
So yeah, back to your point, I think the AOA has said that there's over 267 diseases that can be detected through the eyes. And with that in mind, we're not the only ones who are privy to that information. There are others outside of the sector who are looking to disrupt this eye care and healthcare space in general, eye care specifically, because there's so many different things that you can do with it. Now, we can either sit back and wait to be disrupted, or we can disrupt ourselves. And then we have some more flexibility, more leadership in how this pans out, both for us and also for the patient. And it's interesting, whenever new innovations come into the category, sometimes there's some resistance, particularly if they're outside of our usual scope of of how we manage patients. But after we embrace it and work with it a bit, sometimes we actually find that it makes us more efficient. It makes practicing more enjoyable. It brings more value to the patient, and it brings a little more stickiness to that patient, where that patient starts to see you more as their clinician, the person that they know and trust to provide them with the care that they want.
That's compelling. I agree with you. And I think that we often look at things outside of that standard paradigm of care we've now said we own, and said if it's even on the fringe of it, it might not work. It might not be for us. And that's not just us. I saw that with some of the retinal ophthalmologists I worked with at university-based settings when Optos and Optomaps came out. They were no way. And now they all have instruments, right? So there is a
Exactly.
slide toward improvement. Let's talk a little bit about optometry and ophthalmology. I mean, unfortunately, the gap between the professions in many places remains. I
Mhm.
know that back in my hometown where the practice is still going, there's increasing challenges. And I can't believe in this day and age, we have less collaboration. But as I think about some of these folks looking to the primary medical care professions, what should we be doing to, if anything, to further our relationship with ophthalmology?
Well, I just want to do a flashback since you mentioned that this is still going on. At the end of the 80s, when I first started practicing, my first job was a hospital-based optometry ophthalmology co-management practice, which for all intents and purposes did not exist at that time. But fortunately, the younger ophthalmologists in the group had trained at the Indian Health Services with optometry residents. And he said to me, I know what optometrists can do. And I want you practicing to the fullest extent that you can practice so that I can practice to the fullest extent that I can. So with that in mind, that's how I started practicing, doing all pre-ops, post-ops, foreign body removals, any infections, all of those things. And one of the things I realized right away was that I was handicapped to some degree because I didn't have hospital privileges. So I went to the president of the hospital and I said, I'd like to have hospital privileges. And he said, well, we don't really have any rules for optometrists. And it wasn't like you can't have them. It's just that we don't have any. And so I said, well, I'll write them. And I did. And they were voted on and accepted. And that hospital still uses the genesis of my rules today for optometrists to be able to have hospital privileges. So I think we just have to get out. We can't make assumptions that something is not for us or we're not going to be accepted. A lot of times, particularly in the healthcare space, since we go through a different avenue and don't go through medicine exactly, a lot of medical colleagues don't know what our capabilities are. So it's incumbent upon us to educate them on those opportunities. So now with optometry and ophthalmology, and particularly with our associations, and I spend a lot of time working with our associations, and I value them greatly because to me, they're our insurance policy to help continue the stature of our degree and to help us to gain the rights and privileges that our education affords us. That being said, in 2024, almost 2025, optometry and ophthalmology should be working closer together now to help maintain this space that, again, we've got comfortable as our domain, that if we're not careful, it's not just the other primary healthcare providers, be it family medicine, and my husband's a family practitioner, internal medicine, or a number of other nurse practitioners and others who will be doing utilizing AI technology to do a lot of the things that, that we've been doing to support some of our medical colleagues with their HEDIS scores and things like that. We can easily be displaced because those things can be done without our direct input. And I dare say, the patient ultimately will suffer because there are a lot of things that technology alone just can't do for the patient. But it's an opportunity for us to take a pause in our turf battles, if you will, and to look at how we can best work together to ensure that the patient ultimately receives the best care and best healthcare experience that they can receive.
What's forgotten about those days, dating back to your stories from the late 80s, all the way through all of the state therapeutic law passages that happened, is that most of the successes occurred at the grassroots level, where optometrists and ophthalmologists who had good relationships advanced those regardless of the kind of formalized opposition that might be there from organized medicine in particular. And what I think is happening today, and poke at my colleagues a little bit here, is that they're taking it easy on the fellow ophthalmologists they work with. They haven't built a deep enough relationship. Sometimes it's all about, we just have too much going on in our practices, but we cannot stop talking to these folks, helping them understand what we're doing and laying claim on the things we do. To your point, pre-op and post-op care. I just think we should be telling our ophthalmology friends, that's what we do. Do your thing. Wouldn't you agree that we have lost a little bit of that verve, that push to make optometry clearly understood in ophthalmology?
So I absolutely agree with you. I think we have gotten actually kind of lazy. I think we are sitting back and resting on the laurels of previous years. I think a number of new colleagues coming into the profession don't realize that not too long ago we could not even use drops to dilate a pupil. I'm not talking about treating anything. I'm talking about just opening the pupil so that you could actually see into the eye, and that took a lot of grassroots efforts. It took a lot of work. It took a lot of chicken dinners. It took a lot of going in and talking to legislators. When I was practicing in my hometown area, the state senator, the state representative, the U.S. congressperson, every single legislator in my area was a patient. And that's because I asked them to be a patient, because I told them this is a service that I can provide and I want you to come and experience it. And they did. And then when they needed something from me, like I had my state senator had an irate constituent who was upset that that darn optometrist, wasn't me, but this optometrist wouldn't give them a renewal of their prescription that was 5 years old without them coming in. And they were up in arms and she didn't know how to handle it. So I asked her, do you mind if I write the letter for you? And she said, oh, God, I'd love you to do that. So I did. And so anytime there was anything that had to do with eye and even sometimes just general health, she would come to me and ask my opinion of it before she went in to vote on it. So that's the type of relationships that we need to have with our legislators. And then, and we also need to support our schools. Because again, if your school does not have the resources to continue to generate the caliber of practitioners to take care of these patients, and particularly with optometry, considering that ophthalmology programs are shrinking now, the patient population is growing and people are living longer. So who is going to take care of those patients?
Yeah, I I think that probably a few of you listening are saying, "Oh, this sounds like just sort of typical AOA speak or, ASCO speak from schools and colleges." But Dr. Knight, you've been at the front of all of this, particularly in these years, not just in running your practice, but in these years of leading the profession from the industry side. And I put a lot of value in what you tell us. So, as a closing point to the audience, we've motivated them. We called them a little lazy. What are they going to do in their practice next week as they've listened to this? That's going to change this. I suppose it's maybe dialing the ophthalmologist, the primary care docs, trying some of these new technologies that emerge that they might think are a little bit controversial. I mean, that seems like an obvious list, but can you motivate them for us to finish?
So I'm going to do some segmentation. So let's start with the new practitioners. New practitioners coming in to practice. From the moment that you start in whatever way you choose to use your degree, start thinking about who you are, what your mission, your vision, your values are, because that's going to help you as you navigate different opportunities that you have in the profession. And also from the day that you start, think about your exit. Think about how you want to end your career at the same time. And I think that will help us as we start to, as you move through your, journey in choosing the right way to honor the optometric oath that you take. And then for those of us who are more seasoned, I would say there's always an opportunity to reach back out, to mentor, to engage with not just ophthalmologists, but endocrinologists, all other types of practitioners that you might be able to be in touch with, because you should be sharing information with those primary care providers, since you are providing a very, very important and critical part of their healthcare journey for those patients. And so continuing to do that so that our healthcare colleagues know the value that we bring to the healthcare infrastructure, even though we don't grow up in it, if you will. And then lastly, I would say hold our associations accountable for not business as usual, But some segment of our associations has to do the day-to-day operations to make sure that we can continue to keep our rights. We can continue to call ourselves doctor, and ridiculous things like that come up. But some subset of our associations also has to be focused completely on the future. What direction do we need to do now, today? What stakes do we need to put in the ground today to ensure that we're not 5 years from now looking back at not just the players who are in the industry right now, but the players that are non-healthcare disruptors, the Microsofts, the Amazons, the people like that who are very aggressively looking at this industry and moving forward in this space. And they will disrupt us. I think that they're smart enough to know that it's best if they work with us. So let's open up the opportunity to be able to safeguard how our patients are taken care of and to be able to utilize our expertise and utilize the resources they have to bring not only a great patient experience, but also to bring some of the richness in how we practice and some of the joy back into how we practice every day.
Joy. I love it. Dr. Millie Knight, thank you for being our guest on today's Think Again podcast.
Thank you, Scott, as always.
And that's it for today's Think Again podcast, brought to you by GPN Visions, a peer-to-peer learning community to help grow your eye care business.